Unfortunately, there is no trailer for the Sybil movie, so we created a brief synopsis. Sybil is a movie about a young woman attending a university who is sent to a psychiatrist following what seems like a hysterical episode. Dr. Wilbur, her psychiatrist, discovers that Sybil's personality changes when she begins to talk about traumatic experiences from her childhood. The movie takes place around the 1940s, and at this time, dissociative disorders have not been recognized under the DSM, and Dr. Wilbur had to fight with her male colleagues to get dissociative disorders to be recognized as a legitimate mental illness. Through conversations with her multiple personalities, Dr. Wilbur learns that Sybil uses these personalities as a defense mechanism against remembering her childhood abuse. Our client is Sybil Isabel Dorset. She is a Caucasian female estimated to be between 18 and 21 years of age. She is a full-time art student at Columbia University, and her marital status is single.
Some of the signs and symptoms of Sybil's mental illness are that she experiences gaps in memory, short-term and long-term. For example, she doesn't remember painting several paintings and drawings that she ends up finding in her apartment. She is also not always oriented to time and place. For example, she comes to consciousness somewhere in Philadelphia that she doesn't know, has never been before, and she doesn't know how she got there or what day it is. Then Sybil starts talking in different tones of voice and accents. For example, when Sybil presents as Victoria, she says that she is from Paris and she speaks in a French accent. Sybil also changes personalities and she's easily irritable. The following clip is an example of her changing her personalities.
And I never learned the math.
Yes, but someone else obviously did. I mean, your checkbook gets balanced, right? Doesn't that prove that when you're not here that someone else is taking care of you?
Who would do that for me?
Her name is Peggy.
Stop trying to make her believe in me when she obviously doesn't want to.
What?
I took over because she was mad about Grandma dying.
When Sybil presents to Dr. Wilbur, she is neat, her speech is normal, her eye contact is intense, she has normal motor activity, and she has a full affect. Her mood is anxious, angry, and irritable. Her orientation depends on her personality, so if she was Peggy 1 minute and then she becomes Sybil, she may not know where she is or what she's doing. Her memory impairment can be short-term and long-term, and her attention is distracted. Sybil experiences no auditory or visual hallucinations. She has an intent for suicidality, but no intent for homicidality or plan, although when defensive in her other personalities, she may become aggressive. She has no delusions. Her behavior is guarded and agitated. Her insight is poor regarding her illness, but her judgment is fair.
This is a brief summary of the character Sybil. She is an only child, her mother is dead, and her father is still alive. Her father worked as a carpenter, and her mother suffered from schizophrenia. She attends college at Columbia University, and she's an art student. She does not have a job, and her therapist is her only friend, Dr. Wilbur. Her family was hit hard during the Depression, and she did not understand what would happen during her blackouts. She thought she would just sleep. She had little understanding of her condition.
Our main DSM diagnosis for Sybil is dissociative identity disorder. Out of these criteria, we most see disruption of identity, recurrent gaps in the recall of everyday events, and the causing of significant distress or impairment in Sybil. We primarily see the disruption of identity characterized by 2 or more distinct personality states, as she herself has 16 distinct personalities. We also see recurrent gaps in the recall of everyday events, as she does not remember what she is doing when she is experiencing the other personalities. For example, she makes a whole chicken dinner that she does not remember, which is shown in the following clip. Finally, these symptoms cause significant distress and impairment in Sybil, as she is seen crying, hyperventilating, and unable to control her emotions. This is our secondary DSM diagnosis, which is depersonalization derealization disorder. Depersonalization is the experiences of unreality, detachment, or being an outside observer with respect to one's thoughts, feelings, sensations, body, or actions. This is exhibited in Sybil when she cannot recall when she last paid her bills. Also, she did not know what state she was in when in Pennsylvania, or the date or Derealization is the experiences of unreality or detachment with respect to one's thoughts, feelings, sensation, body, actions. This is observed when Sybil epitomized emotional and physical numbing, in which she unconsciously created the personalities to numb or try to cope with the uncontrollable abuse she experienced as a child.
November 7th.
Beg your pardon?
How long have I been here?
Let's see. You arrived here on the 2nd. So this is your 6th night. Here, this is for you.
Our priority nursing diagnosis is self-directed and other directed harm, related to child abuse and unsatisfactory parent-child relationship, as evidenced by attempted suicide and history of destruction to the property of others. This is our priority nursing diagnosis because it affects the safety of Sybil and those around her. Our short-term goal is that the client will seek out staff at any time if thoughts of harming self or others should occur, and our long-term goal is that the client will not harm self or others. One of our short-term interventions is to determine the suicidal intent and available means, and one of our long-term interventions is to remove all dangerous objects from the client's environment. In the next clip, you will see Sybil attempting to commit suicide.
Our second nursing diagnosis is disturbed personal identity related to childhood trauma, childhood abuse, and repressed memories, as evidenced by we are not the same person and none of us is Sybil. People say I do things I haven't done. Sometimes I'll meet people I've never seen before that say they know me. Sometimes I'll find clothes I don't remember buying. A short-term goal is the client will verbalize understanding of the existence of multiple personalities within the self. Our long-term goal would be client will understand the need for the existence of each personality and the role that each personality plays for the individual and how each personality has allowed her to cope in life. A short-term intervention would be help the client understand the existence of each subpersonality. A long-term intervention would be help the subpersonalities to understand that their being will not be destroyed, but integrated into a unified identity within the individual. This is the rest of the scientific rationale for the second nursing diagnosis of disturbed personal identity. The following clip is an example of Sybil expressing disturbed personal identity.
Different people, Doc. I'm Marsha. And I'm Vanessa. And I'm Mary. And I'm Peggy. Ain't you sweet? Vicky. We are not the same person, and none of us is Sybil.
Our third nursing diagnosis is impaired memory. This is related to Sybil's childhood trauma and childhood abuse, as evidenced by memory loss, including the inability to recall selected events related to a stressful situation and the inability to recall one's own identity. Our short-term goal for impaired memory is that the client can verbalize an understanding that memory loss is related to stressful situations, and they will begin to discuss their own stressful situation within the first week of treatment. Our long-term goal is that the client will recover deficits in memory and learn coping strategies to deal with stressful situations within 2 months of treatment. One short-term intervention for impaired memory would be to obtain as much information as possible from the patient and any family members. In Sybil's case, this would include interviewing all of her personalities. One long-term intervention is to identify any unresolved conflicts and help the client identify possible solutions. The following clip is an example of Sybil's impaired memory.
sorry. I'm really very sorry.
About what?
About missing our sessions last week.
You didn't miss any sessions.
Several issues relating to legality and spirituality include when Dr. Wilbur touches Sybil on her face during a very heightened situation. This caused Sybil to escalate and grab a pair of scissors, putting them both in danger. Another example of when legality and spirituality were threatened is the demonstration of crossing barriers and creating blurry lines between professional and personal life for both the client and provider. An example of this is when the doctor let Sybil into her apartment when she was about to go to sleep. Another example of a professional and personal barrier being crossed is when the doctor relieves Sybil from the hospital, personally taking off the restraints and retreating back to Sybil's apartment for coffee. Another example of a legality and spirituality issue is when the doctor uses leading questions in coercive language when speaking to Sybil. The following is a clip of the doctor crossing boundaries as she tries to convince Sybil to be hypnotized.
Mission to hypnotize you. No, now I know that I promised I would never do that, but there was so much that I didn't understand back then, and well, you didn't know me and didn't trust me, but now you do, don't you?
Yes.
Good. And I think we should start this weekend. We can go to my house.
This is our concept map for Sybil's case. It includes our 3 nursing diagnoses of self-directed and other directed harm, disturbed personality identity, and impaired memory. At this time, there were no medications for dissociative identity disorder because it was not recognized by the DSM. However, if medications were available, our recommendations would be an SSRI like fluoxetine or an antipsychotic like chlorpromazine.